Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is hypertension? Is it the same as high blood pressure?
Hypertension is actually the medical term for blood pressure being high. And when we say blood pressure, we mean it's the pressure within the blood vessels of the heart and the vessels of the body. So essentially, it is one and the same thing. And it's just a medical term used for blood pressure being high.
What causes high blood pressure?
There are a lot of causes of high blood pressure. A lot of time it is related to the lifestyle of people. It's related to their diet, sedentary lifestyle, related to their weight. Sometimes it runs in families. Sometimes it is more related to other diseases within the body, like diseases of the kidney, diseases to do with their thyroid.
How does someone know if they have high blood pressure?
Quite a few times blood pressure does not manifest itself. People do go asymptomatic with blood pressure being high. Sometimes people do notice that they have problems related to the heart, like they find their heart racing, they start experiencing chest pains, sometimes headache, sometimes feeling tired. Sometimes people do have more serious stuff like having a stroke, which gives them the clue that there is some underlying high blood pressure going on.
When I get my blood pressure taken, what do the numbers mean?
Basically, when we see blood pressure in somebody, we calculate it as two numbers. The first number is considered to be the systolic blood pressure. That is the blood pressure when the heart is actually squeezing the blood out. The second number is the diastolic number, which is the number when the heart is relaxing, that is not squeezing the blood out or in between two heartbeats. So whenever we calculate somebody's blood pressure, like the normal blood pressure, we would calculate as 120/80. It would mean 120 is the systolic blood pressure and 80 is the number for the diastolic blood pressure.
Are there any symptoms to let me know my blood pressure is rising?
Most of the times when people who are well aware of their diagnosis of high blood pressure would probably experience increased sweating, feeling tired, some chest pains or heart racing symptoms, feel one side is tingly or the other, but it's not uncommon for people to not know that their blood pressure is rising and they have something serious like strokes or something serious going on when their blood pressure is going up high.
What can someone do to regulate their blood pressure?
There are a lot of things what people can do to help control their blood pressure. Most importantly, make sure they have a good lifestyle. When I say a good lifestyle is to make sure they don't have enough, make sure they have less of fat in their diet, low salt in their diet, exercise at regular intervals, keep an eye on their weight, go for regular walks so that they don't gain weight. Alcohol also has some role in terms of increasing blood pressure. So most of the time it's lifestyle which can make a big difference in somebody not going to a point of having real blood pressure problems. And if a lifestyle does not completely resolve the blood pressure issue, there are certainly medications out there wherein we can help in terms of decreasing blood pressure.
How often should you have your blood pressure checked?
I would say somebody with a known blood pressure problem should have their blood pressure checked at least once a week. There are lots of places where they can check their blood pressure. There are blood pressure monitors available out in drugstore and even in retail stores wherein they can buy and check their own blood pressure. As far as somebody who doesn't have any underlying blood pressure issues, whenever you go to a doctor's office, you can get it checked, or even once in 6 months, get it checked at a retail store or a drugstore, and keep an eye on their blood pressure.